is Raven Ivy, and I'm going to give you a story about my fibroid journey that I just experienced this past year. And to be honest with you, this will be probably 2 or 3 parts, just because my experiences had some challenges and complications, and I feel like I need to share just as others have shared. So many women have talked about their infertility journeys, their fibroid journeys, their endometriosis journeys on social media. And if it wasn't for some of those ladies, I wouldn't have been as prepared as I was to endure some of the things that I've endured after having the fibroid removal surgery. Let's start. When did I first have problems? Like many of you know, women of African American descent or mixed heritage, those that are, well, not even just women of mixed heritage, let's be honest, women in general, we have a lot of heart issues we have to face. We have a monthly cycle. Some people's cycles are great, some are good. And it's not necessarily an African American, I won't say disease, or I don't even want to call it disease, situation. It affects every woman, but it's just more prevalent in that community. And no one knows the cause of it. No one knows, they don't really know the cause. We know to remove it, and they do have treatment for it. But it's not like you live these unhealthy lives, you're going to get this automatically. It's not like, diabetes, if you eat too much carb-induced food, you're going to have high blood sugar, because that's something you can measure. You see women that are highly active and work out and eat healthy can be affected by having fibroids. Everybody's journey is different. There are researchers probably right now working to see if there are some genetic links, and you can trace to say, hey, if my mom had it, I have a possibility of having it, but no one for certain can say that this is a cause. And I'm not a medical professional. I do have some experience in research, but I haven't researched this to say these are the medical findings. But what I can say is, from my experience, my menstrual cycles have been very inconsistent. As a young girl, my first sighting of a cycle was when I was in 3rd grade. And I believe I spotted at the hairdresser, and I was like, Mom, I got my period like you. And I thought it was the greatest thing in the world. And I couldn't understand what was this spot in my pants. Well, what was unique is I didn't get it again. I didn't get it again until 7th grade. And when I got it, it was just like, God almighty. Like, where's these pains coming from? And, go through 7th grade and 8th grade, you have that time, and you go through high school. And I remember having to check out of high school to go home. I remember checking myself out. I would go in the restroom of my high school and call and say, hey, this is Raven McDonald's mom. She needs to check out. She has a doctor's appointment. And I would go home and just lay in the bed. I would have so much pain, and I would take so much ibuprofen or Midol or Pampering just to kind of ease the inflammation or whatever was going on. And I remembering messing up my clothes and being so embarrassed during that time, wearing oversized clothes and start wearing very dark clothes. And, I even remember going to the hospital at one point, and the lady thought I was pregnant. I was like, I haven't had sex. I don't know what this is. You could be experiencing a miscarriage. And at that time when I got examined, I don't think my hymen had broken. And I know you could examine a hymen at that point either. And the lady was like, she's a virgin. I was like, well, duh, I told you that. And she goes in and she says, and I remember her telling my dad, you ought to be proud of her. She's not having sex or anything. I said, I told you that. Listen to me. I'm hurting. And I couldn't understand why I was losing so much blood. Well, I remember going on birth control pills. And from birth control pills, my hair started falling out. My face started to break out. Weight gain was crazy. Like, I just went from a size 6'8" to a size 14, 16, like overnight. And just didn't have any energy to do anything. And so I remember my cycle would last at that time about 8 to 9 days. Fast forward to college, I'm a little bit more active. Now I'm doing things that could possibly result into a miscarriage, but I'm taking all kind of birth control. I'm trying every kind of thing. There were days I would skip class, or I wouldn't go to class, or I'd be stuck in the dorm room because my stomach hurts so bad. And I remember, not in undergrad, but in graduate school at Tuskegee University. And if I have any of my lab mates, I could call their names, but many of them know who we all worked in the lab together with, and Dr. Troy's lab. I want to thank you. I think it was Faye Mayo at the time, and Crystal Martis and Francesca. Well, I did call their names. I remember they were around me, and they actually went to the hospital with me because I had so much blood just flushed to the floor. And I don't know if they saw that at that point, but they ended up saying, you need to go. And Dr. Troy, Faye got me to the hospital fast. And my family met me there from Birmingham, and the doctor was saying, have you ever heard of PCOS? And at that time, PCOS, polycystic ovarian syndrome, I remember having a cyst on my ovaries before, and it hurt so bad. And they did all that examination. They were worried that I had a cut in my uterus or something because I was losing so much blood. But I guess my blood levels were okay. And so I remember going home. They gave me some pain pills to rest. And I ended up going to see a specialist in Birmingham because that doctor said, you need to come and see me. And so when I went to the doctor in Birmingham, that doctor did like a procedure, and he said, well, you have a little bit of endometriosis. And so he did the first, laparoscopy, DNC. And so he basically was like, it'll get better once you have a baby. These things can go away. And that was it. Put me on more birth control, more hormones. I think that was the first time I've heard of progesterone, and I was taking that. Fast forward, many surgeries, many obstacles. I get married at age 30. Now, up until this time, I had several surgeries because my cycles were just horrible. I'm bleeding for months. I remember one surgery before my marriage, I bled from maybe October to February. And it was in between heavy and light, and that was just so miserable. It's like the woman in the Bible with the issue of blood. And I remember having that surgery again, and that was a confirmation. Yeah, you got a little bit more endometriosis, just a mild case, but everything else looks good, and we're going to get you through this. And so they started me on Lupron Depot. And if any woman has been on that treatment before, it's a lifesaver because you don't bleed anymore. However, it puts you in a state of menopause. And so through that menopause, I remember having the hot flashes, my hair, just the whole center of my head, the hair there began to thin. And face would break out really bad. And I do still have some of the marks on my face from having those breakouts. And of course, over the years, your skin regenerates itself, so you can get new skin and you can clear up some of those marks, but some of those marks haven't gone away. But I remember going through that and having to go in once a month to get this shot in my arm so that I can, not have a cycle. And so I was hormonal, emotional. I would eat and I would exercise, but it wouldn't do anything. And so just that hormones that you just go through was just a lot. And so that happened. Of course, I was in a very unhealthy relationship at the time. So just think that added stress, the stress of grad school, thinking, I'm trying to make some decisions for my life. That just wasn't good at the time. So I ended up going to, end up kind of moving past that. Got off all the hormones at that point. I said, I'll never put any more hormones in my body, which I lied at that point, but we didn't want to do that. And so I kind of began to have almost a clean lifestyle, eating healthy, working out. So I've lost the weight. I'm not on hormones. I'm in a fresh start. So I transitioned from living in Birmingham to moving to the top of the state of Alabama. and I'm starting to get healthier. But stressful days, I have those issues with my cycle again, and it would put me to the point where I couldn't work. I couldn't do anything. I couldn't function. I was scared I'd mess up my clothes if I did anything. And so I battled with that for a while. So when I got married, of course, one of the natural things or the question they always ask is, when are you going to have a baby? And by this point, I'm in my 30s, and I know that what they say about women when they're 35. And when we first get married, we end up having, I guess, a honeymoon baby, according to my physician at the time. And he said, well, it wasn't successful. So what you saw, it was a big clot that came out, was possibly a miscarriage. And so he said, well, we're going to do a D&C to clean you out and just kind of get you started. And then, of course, tests were ran, and, they found out, you have abnormal cells. So I'm dealing with the abnormal cells, the heavy bleeding, and now we're going to put you on more hormones. Well, the transition of that year, things happened, and my husband and I relocated to his hometown. And I remember having that same thing happen again as I started a new job and kind of knew what it was, went to the hospital here. They said, oh, you need to go see an OBGYN. You need to go and find out what's going on. So I tried to make an appointment there, couldn't get in. And so for a couple of months, I just endured what I needed to endure. But I ended up talking to one of my now friends who recommended a wonderful physician, who's my physician now. And I have fallen in love with this lady. Like, number one, she has her stuff together. Her bedside manner is nice. She can understand. She empathizes with her patients. She encourages you, and she works through those issues. She really listens, because sometimes half the battle is finding someone who's really going to listen to you and see what your problems are versus someone who's not. And so I can say my Dr. T listened to me. She listened to the struggles I went through, what I've experienced. And part of why I went was because of fertility, because we wanted to have a baby. But I also wanted to see why my cycles are so heavy and I'm not feeling my best. I don't have the best energy. And so what Dr. T did, she put me on some medicine to cut the bleeding down, to slow it up so that I could not lose so much blood. And I took that medicine for a while. She said you're going to experience some headaches, but those headaches got really, really bad. And so my body didn't tolerate medicine. And one thing I've learned, I can't tolerate a lot of medicine. I can't tolerate hormones, because we tried. I told her I don't want to do hormones. I've done every last birth control pill. I did the low estrogen birth control. I've done the seasonal. I've done so many different brands of birth control. I remember opening my drawer at home and I see different cases with different brands. And that was one thing I did not want to put back. And so she said, well, I needed to take a look. So she did my first laparoscopy, D&C, to diagnose me, to make sure my tubes weren't closed. And I remember she opened my tubes, and we kind of got the cycle to more of a stable consistency. What I mean by that, at that time, I would bleed in the, I couldn't track my cycles, because I could bleed today, stop tomorrow, and then start maybe 2 days later. Well, this time now I'm coming on once a month. And then with the help of that medicine, I'm bleeding less at this point. So when she first went in, there was no sign of fibroids or anything. So early 30s, everything was looking good. And so we began to do Clomid and begin a fertility journey. Of course, we found out some things from my husband. He had some things he needed to do as well on that journey as well. And so fast forward, 2-3 years from there, I turned 32. I had this issue where I couldn't stop bleeding again, so I bled for a couple of months. And she said, well, let's go and do a D&C to kind of clean you out and see what the issue is. And she did that, and at that time, I think she found one fibroid. And it was embedded in my uterus, and she said, I don't want to touch it right now because it's small, it's not in the way, it's not going to hinder anything, and these things can shrink over time. So we did that, did the D&C, cycles are better. No problem, once a month. Start eating healthy again, start exercising again. I even at this time I cut out pork. And for a while I wasn't eating pork anyway, but I started eating it again once I got married to a point, but then I brought it back in my diet and I started eating all kind of stuff. Pork, deer, fish, shrimp, all of that. So I end up, trying to cut things out as my husband got through his journey. And so we end up changing more of a keto lifestyle where we were eating meat and vegetables mostly. But then I started pulling away from the red meat. And then all of a sudden chicken started making me sick. So I said, let me just cut meat out altogether. Then I realized that I would become inflamed when I would eat dairy products, when I eat a lot of eggs and cheese and milk. And so I cut that out. And so I pretty much had almost a pescatarian / vegan lifestyle, but I would teeter-totter. And so all of this goes on. So I was thinking all of this is taking place, and then October of 2019, I'm weak. I get lightheaded, and my husband has to take me to the emergency room here. And they said that I was severely anemic. And so that started my first iron infusion. Didn't know how that was going to work. Didn't know how my body was going to tolerate it. So we just took some time off to kind of see what would help me to regain that energy and feel better. And I would say everything was going good. Like work was work, but it was good. Like I was enjoying it. And I'm always busy. I always got something going on. Always traveling. Always doing something. I'm a teacher, so I enjoy being with my students. But I wanted to be in a position where I could have more energy. Because I was thinking, man, getting old sucks. I can't do the things I used to do. Because I remember I could work on projects all the way to 1-2 o'clock in the morning, and all of a sudden that energy level is gone. I don't have that energy anymore. So now that took place. In between there, we've been blessed. We still haven't had a child physically, but right after that surgery that happened that June of 2017, we were blessed with a beautiful baby boy September 2017. He was 2 months, and that's a story in itself. And he is our son. He's been our baby. He's 3 years old now. I would show you a picture of him, but I think I'll wait to kind of save that. And so my husband and I, we just went through just that tough time. But by this point, we were content. We had a beautiful, healthy baby boy. He's smart. He's intelligent. Oh, he is so loving. And so that in itself was peaceful. And it was like, well, God blessed me with a baby. So the desire to just have a baby is not there anymore. But I do have the desire to go through motherhood, through the conception, through the birth, to actually hold a baby. I won't say that desire is completely gone, but I am blessed to have a son that calls me mom and loves me dearly, and I appreciate that, and I'm thankful to our God Almighty for that. But I say all of that because my mind wasn't on pregnancy. My mind wasn't on getting pregnant. I knew that there was a possibility I could get pregnant, that my system was good, but that wasn't my focus. And so I ended up wanting to be just healthier for him. So I kind of battled with the anemia for a year, and it got so bad that October, my wedding anniversary, October 9th, 2020, I go to a specialist at the hematology oncology clinic, and they find out that I'm so anemic. They say, you're so low, you need blood. And they say, you're going to have to go to the hospital to get typed ASAP so we can get you some blood in the next couple of days, if not today. And part of our anniversary, we had plans. I said, well, can we do it on Saturday? I got something to do. I'm always like, can we do it another day? But we end up getting that blood typing done that day, and we enjoyed our anniversary date. We had dinner, we did a couples massage, and it was a wonderful weekend. And then that Monday, we spent that day in the hospital, and I ended up getting 2 units of blood. And what kick-started this fibroid journey was that a month later, I start my cycle, and I'm bedridden. and I bleed and bleed and bleed. And it's not just any kind of blood loss. It's almost 4 overnight bags of pads bleeding, and I'm sick and I'm tired and I'm weak. And when I get my blood checked again, because I called the doctor and I said, this is not normal. And they said, you need to see your OB. And I remember calling her and telling her how I felt. I really called on a Monday. They called me back. I never got the call. They were going to make an appointment for me to come in Tuesday. I ended up going in on that Wednesday. And everybody know with the COVID-19 pandemic, we've been teaching from school and virtually or from home. And so, of course, I had to take time off away from my class just to go to the doctor. And I found out that either I can find out, number one, they schedule ultrasound right away. My doctor does the ultrasound because she kind of knew something wasn't right. That one tumor grew. They only saw 4 more, but it could have been more. And so she said, you have 2 options and you got to make a decision because you're over 35. She asked, what are your choices at this point? And at that point, I wanted to have a baby. I'm thinking by 40, 50, if it ain't happening, I don't have, but I'm close to 40, y'all. So I said, maybe 50, 55. You know, if nothing happened, we can go ahead and take them out. But you have some great women that just gave birth in their 50s and their baby's my baby's age. And so I had to make a decision. So that was a conversation because I'm submissive. I believe that my body is not my body, it's my husband's. And so we had to talk about the choices. And he said, I want my wife, but if it's a chance to have a baby, let's keep that chance. And so the options were a myomectomy or hysterectomy. Well, I didn't want her story to be a history. So I ended up having the myomectomy. And wasn't sure which one I was having because I was like, is it going to be a laparoscopy? No. She said, make a little tiny incision. Tiny incision is an open myomectomy. And so December 3rd this past year, 2020, I go in and I have 7 fibroid tumors removed, all various sizes. And one is huge. And the rest of them were all so cluttered that my whole entire uterus was filled with them. And so that surgery went well until I caught an infection. But it was a good surgery. Everything looked good. She told us we needed to wait a whole year before we have a baby or to try to conceive. And so we left the hospital, had the surgery the 3rd, you stay the 4th. We end up leaving like the 6th because I wasn't able to urinate the 5th or the 6th. And so I came home. Of course, it was painful because the open myomectomy is like a cesarean. And so that was just kind of hard to move around, to cough, to sneeze, to do different things. And I'll give you some tips that my husband did for me and what I found that were helpful. And there's so many websites and social media groups that can help. Like we can wear white off Instagram. They have been very instrumental. Some of my Tuskegee sisters, the Brown Girl Tribe, you got to follow her. She's amazing. But we went to Tuskegee at the same time and we reconnected through Instagram, and she gave me a wonderful list to help me get through. And then, of course, there are brave women who shared their stories of how to prepare for the surgery or what was their experience so that you can have an outlook. Those things helped me prepare. And as a teacher, I went ahead and got units of work done, and their work was done all the way to the end of December because I just knew I was coming back the first of the year. But I never anticipated what the complications would be. There's always risk in surgery, but complications come from, different things. How well you keep yourself, how clean the instruments were. And so for me, we've got the housekeeper to come in. She pretty much does a deep clean over the house. Everything is pretty much set up in place. Meals are put in place. My son was taken care of. My mom came down to watch him while I was in surgery. My sister and her husband came and made sure everything was there. Christmas was already taken care of. But that week after my surgery, that 9th, I experienced a very high fever. And so in part 2, I didn't want this to be long. I want women to know that your journey, you never know when you'll get hit with something, and that we all suffer through something, and everybody has something to share. And so I wanted to kind of share my history of fibroids with you, but I'm going to talk about the surgery and the preparation, and then I'll talk about some of the complications. But I first want to say I was blessed to have a great doctor. And of course, I wish many would listen to her because they didn't know what was wrong. But she had the foresight to have a second surgery, and I'll talk about that in another video. But she had the foresight to kind of treat me, and her bedside manner was perfect. And the fact that she checked on us, we were family. I mean, if I need to give her a kidney, I would. But it was an experience, and it was a journey, and I'm so thankful to God that I can share this with somebody. I don't know who this is for, but I'm going to share this because I can hold it to myself. But I experienced so much of God's grace in that room, and that it would be very selfish of me if I don't share. So I do want to share my journey. I do want to talk about it. I am still going through it. This is my 6-week post-op. I don't want any woman to be scared to undergo it. I want you to be strong, but you do need a support system. You do need to take your time to heal. I'm the one talking. I'm just blessed to be working at a district where our students are not in here face-to-face, so that I could still be at school to teach them, because that gives me energy to be able to give back to them. So with that said, this is already long enough. I will talk to you in the next video. Bye.